Hey, welcome back to Table Talk. This week we're going to talk a little bit about the coccyx, or your tailbone. Have you ever fallen on your butt so hard that it just really hurt? Chances are you may have actually got a little piece of that bone at the very end of your tailbone, which is called the coccyx, and it may actually kind of bump forward or to the side. If it does that, it's very painful. Okay. Here's a little bit of a model right here. You got your sacrum right here. At the very tip of that, you have what's called the coccyx, and that coccyx can go, again, right, left, and that causes a lot of discomfort and pain, especially when you sit, okay? From the side of you, you have your low back, you have your sacrum, and at the very tip, again, that coccyx, it really can cause stuff, more than just pain. It can actually cause a bloody stool if this kicks inward. So you can actually get a bloody stool from this as well if you fall real hard on your tailbone, such as maybe ice skating, or you fell off a swing or a skateboard or something. I mean, it could be anything. But you know, this is not uncommon. I do see a couple of these each year come through my office, so it's not completely uncommon. There are things that you can do to also help alleviate it and help out, because unfortunately when you have coccyx pain, you really don't want to sit. It really hurts that bad. And especially if you're sitting on a hard surface like a chair, that's like a wooden chair or something like that, without any comfort and without any cushion, you could really hurt that, irritate it, because it's almost like you're re-injuring it every time you sit on a surface that's really hard, and that's pushing this area right here to the side or in the front, and that really hurts that. So they do have what's called a coccyx pillow. That coccyx pillow, it's kind of like a donut, but it's not. Coccyx pillow looks like this guy right here. Your feet are over here, and your coccyx kind of sits in this little bit of a hole right here, so you don't have any direct pressure on it. So I'd highly suggest, if you do have tailbone pain, to also get yourself a coccyx pillow and get it adjusted, because this is still going to be kicked off to the right or left regardless of whether or not you're using the coccyx pillow, and you do need to get that addressed. And so this is what we can do. There's different ways to adjust it. The way I adjust it is with the tool. It's a lot more gentle. There's different ways to do it though. But we adjust the coccyx. We try and help alleviate the pressure on there by moving it over right or left, and sometimes if we can pop it back a little bit too, that does help. But it does help in conjunction with the pillow, because again, you're still going to be sitting on it, and you know, your visits are usually, you know, not one day after the other. You're having them a couple days apart, and so we really need to get a structural correction in order to help out the coccyx. But yeah, if you've ever fallen on your tailbone and you're wondering what you can do, this is what you can do. You can come to a chiropractor, have them assess it, see if there's something that we can do. Often we can, and then we might make that recommendation to get this pillow. That way you can alleviate some of that pressure there too. All right, guys, keep following us. We'll keep giving you good tips. Take care.